On Capitol Hill today, lawmakers discussed a possible crackdown on surprise medical bills for hospital services and treatments outside patients' insurance networks. This includes air ambulance costs. A helicopter ride to the hospital can cost more than $36,000. Mireya Villarreal has more on this in our series, Your Money, Your Health.
When Joseph Penrod's son accidentally swallowed a bunch of prescription pills, his wife panicked.
The first thing that she did was call poison control, and they talked to her about getting him to an ER as quickly as possible.
And didn't think twice when he was airlifted to a better hospital.
They suggested that they were not appropriately equipped to deal with that particular age of patient in that particular condition.
And when they recommended that he be transported, he was stable?
Yes.
His insurance paid for the ER care, but he got slapped with a $40,000 bill for the air ambulance.
I did not have $40,000 laying around. It would have destroyed us financially.
Air ambulances are often out of insurance network coverage because they are independent contractors and negotiate costs separately. They become a growing, lucrative business, making most of their money in rural areas.
The air transport industry, the predominant players are driven by private equity. And the model is very simple. There are people out there in an emergency, they have resources, and we can take them.
Executive Director of the Virginia Association of Health Plans, Doug Gray, says a new Virginia law that went into effect March 1st will give patients the right to choose if they want to take an air ambulance in non-emergency situations and requires hospitals to disclose more cost information.
An accident can happen anytime, any place, and you could be the one who's having that decision made for you. And your livelihood and your savings can be on the line.
Penrod spent nearly a year fighting this bill. He finally offered to pay $1,000, and they took it.
If you're rich, you can get a lawyer, and that's great. If you're on the lower end of the spectrum, then you need to be able to fight for long enough to figure out how to escape.
A fight against hidden medical costs to save something that's priceless. Mireya Villarreal, CBS News, Lynchburg, Virginia.